What is compassion fatigue?
Compassion fatigue and burnout are terms that we're not taught in residency or in most therapy education programs, but they're in the literature and they're used. And I like Charles Figley's notion of compassion fatigue. It means that we are in the business of helping people, and we're compassionate to begin with. And we still have our compassion, our empathy, our caring, but we're tired. We reach a point, sometimes because we've heard so many tragic stories, that we dream about this. We take it home. We need a break. Actually, all along, we ought to be physically fit, emotionally fit. We have to keep up our sense of humor. But that's not quite the same as burnout. Again, a term that's of fairly recent origin, and it's not in the dictionary of psychiatric disorders, but those of us who are practitioners know it. It means we've lost our elasticity. We've lost our reserves. We're not fun to be around. We really need to think about changing our jobs. We're running on empty and we can't fill the tank up again. So I think it's useful to think of compassion fatigue as identifying, empathizing with our clients, not necessarily having too much empathy, but having had too much of a dose of life histories that get to us, and we need a break. And burnout means sometimes through relentless responsibility, sometimes just as an accretion and evolution of difficult times. We're no longer good on the job, and we need to think about changing career focus. There's an interesting similarity and difference between compassion fatigue and vicarious traumatization or secondary PTSD. Sometimes we actually pick up the PTSD of our patients or of our clients. And if you're a clergyman, clergyperson, and you're listening to this, it could happen to you. One of your parishioners has been killed and you're dealing with the family and you hear the details. You could end up dreaming about it. That's happened to my colleagues. I don't know if it's happened to me, but I've certainly been preoccupied with the details of something that is horrifying. And I can feel some of the feelings. I've never gotten secondary PTSD where I have the full range of symptoms and I could qualify for the diagnosis. But I know that colleagues have. And I'm working with people now who are mentors in Veterans Court. They're wonderful. They're back, maybe they're back from Korea, World War II, or Vietnam, and they're dealing with our troops who are coming back from Afghanistan and Iraq. And sometimes the mentor's war experience gets stirred up as they're trying to help one of our current soldiers or Marines. So the compassion fatigue, by definition, is either picking up some of those symptoms or finding yourself anxious, a bit alienated, tired, perhaps not sleeping well, and realizing that because of the job, you're hurting. And that there's a wonderful DVD that we made in Gift from Within called When Helping Hurts. Doesn't matter what kind of a helper you are, you could have some of those symptoms. But the thing is, you still have your sense of humor, you still have your personality, you're still a likable person, and you still like your job. You just don't feel all that well equipped to do it because things have been difficult. That's what I think of as compassion fatigue. Well, each of us have our different ways of dealing with compassion fatigue. First of all, to prevent it or to minimize it, it's awfully important to have a life outside of helping people who are traumatized. Family, friends, recreation, exercise, things that keep up your sense of humor. You know, a lot of us really love our work, and our work is our hobby. So if we're away from work, we're talking about trauma. If we go to a conference, the conference is about trauma. If we go to a movie, the movie may have trauma themes. But we just have to remember to be multidimensional, find ourselves laughing and playing and working out and doing different things. All of that helps to prevent compassion fatigue. And if someone taps us on the shoulder, could be a friend, could be a coworker, and says, you know, you look tired. You've been irritable. What's going on? Could be something outside of work, but if it's that the work is too much with us, we need a break. But we still are doing this to return to the job. It's not burnout yet.